I'm sure you've heard the news, the headlines that flash across our screens, the stories that make us pause and think. But have you ever stopped to consider the deeper narrative, the human lives behind those headlines? But have you heard the story behind it, the real, raw, and often heartbreaking stories that don't always make it to the front page? Today we delve into one such story, a tale that is as tragic as it is eye-opening. Today we share a heartbreaking story from Texas, a state known for its vast landscapes and vibrant cities, but also for its stringent laws that can sometimes have devastating consequences. Josseli Barnica, a 28-year-old mother from Houston, tragically lost her life due to complications from a miscarriage. She was a young woman full of life, a mother who adored her child, and a member of a loving family. Her untimely death has left a void that can never be filled. Her doctors hesitated to perform a necessary medical procedure, fearing legal repercussions under Texas's strict abortion laws. These laws, designed to protect life, ironically put Josseli's life in grave danger. The medical team found themselves in a moral and legal quandary, torn between their duty to save a life and the fear of legal consequences. Despite the urgent need for intervention, Barnica was reportedly told that help could only come once the fetal heartbeat stopped. This delay was not just a matter of hours but stretched into days, each moment increasing the risk to her health. The emotional and physical toll on Josseli and her family was unimaginable. Medical experts reviewing her case revealed that this delay deviated from standard medical practices and significantly raised her risk of a severe infection. The infection, which could have been prevented with timely medical intervention, ultimately claimed her life. This case has highlighted the dangerous intersection of law and medicine, where legal restrictions can sometimes override medical necessity. 3 days after delivering the fetus, Josseli Barnica passed away from an infection. Her family, who had hoped for a different outcome, were left to grapple with their grief and the harsh reality of a life cut short. The empty hospital bed and the grieving family are stark reminders of the cost of inaction. Her story has sparked outrage and reignited the debate on the impact of restrictive abortion laws on women's healthcare. Across the nation, people are questioning the balance between protecting unborn lives and safeguarding the health of women. Protests, debates, and discussions have erupted, each side passionately defending their stance. This isn't just about laws, it's about lives. It's about the real people who are affected by these policies, the families who are left to pick up the pieces, and the communities that are forever changed. Josseli's gravestone, adorned with flowers, stands as a somber testament to the need for change. How many more stories like Josseli's are we willing to hear before we make a change? Stay informed, stay compassionate. Let us remember that behind every statistic is a human life, a story, and a family. It's time to listen, to act, and to ensure that no more lives are lost due to preventable circumstances. The community has come together in the wake of this tragedy, holding vigils and sharing stories of their own experiences. Healthcare professionals are calling for reforms, emphasizing the need for policies that prioritize patient care over legal fears. The collective voice is growing louder, demanding change. Lawmakers are now facing increased pressure to reevaluate the existing laws. Public hearings and debates are being held, with citizens rallying for change. The conversation is shifting, and there is a growing recognition that the current system is failing those it is meant to protect. Emotional testimonies at public hearings have brought the issue to the forefront. Healthcare advocates are speaking out, and community members are supporting each other through this difficult time. The push for change is gaining momentum, and there is hope that Josseli's story will lead to meaningful reforms. As we remember Josseli, let us honor her memory by continuing to fight for a better future. Her story is a powerful reminder of the need for compassion and action. Let us work together to ensure that no more lives are lost due to preventable circumstances. Stay informed, stay compassionate.